Ever wondered how doctors treat pink eye or conjunctivitis? If you missed part 1 of this series where I talk about 5 different types of pink eye, you may want to watch that video first, link in the top right corner. Welcome to another episode of Doctor Says. The first and most important thing is to prevent contagion. Both bacterial and viral conjunctivitis are highly contagious and spread by direct contact with secretions or contact with contaminated objects. That is why infected individuals should not share handkerchiefs, tissues, towels, cosmetics, linens, or eating utensils with others, and should avoid touching the eyes or face at all times. Frequent hand washing is highly effective to prevent the spread of the disease, and alcohol-based hand rubs are a good alternative for disinfecting hands if zinc is not available. As for the specific treatment, just like any disease, it is important to have the correct diagnosis as the treatment for different types of conjunctivitis varies. For bacterial conjunctivitis, it is usually treated with an antibiotic eye drop or ointment. When started early, treatment helps to shorten the duration of symptoms, although most cases do resolve spontaneously without treatment. Common choices of treatment includes erythromycin ophthalmic ointment or trimethoprim polymyxin B eye drops. Eye drops are generally prescribed for adults, while ointment is more suitable for children, as they may have difficulty in applying eye drops. The ointment should always be applied to the lower eyelid, and one may have blurring of vision up to 20 minutes after use of ointment. For patients who wore contact lenses and have bacterial conjunctivitis, fluoroquinolones eye drops are recommended, as they have a high risk of contracting Pseudomonas bacterial infection, which, if not treated properly, could lead to severe eye infection. For the treatment of viral conjunctivitis, a topical antihistamine or decongestion eye drops may help to relieve the irritation. These drops are available without a prescription in most pharmacies. However, particular care should be taken to avoid spreading of viral infections from one eye to the other. Apply drops only to the affected eye and wash hands thoroughly after application. Another option is to use warm or cool compresses as needed. The treatment for allergic conjunctivitis is generally the same as viral conjunctivitis. As for toxic conjunctivitis, the primary approach is to recognize and remove the offending agent. Stopping as many topical agents as possible is a good first step. However, if one has eye drops for glaucoma, care should be taken to not stop abruptly unless ordered by an ophthalmologist, as it may lead to irreversible vision loss. For non-specific conjunctivitis, as a result of a foreign body in the eye like dust or eyelashes, the conjunctiva usually heals quickly and resolves within a few days without any treatment. However, the eye may feel better faster when it is treated with a lubricant, such as eye drops or ointment, and this lubricant is widely available in most pharmacies without needing a prescription. Now, as for the question, when can one go back to work or school? The safest approach to avoid spreading viral and bacterial conjunctivitis to others is to stay home until there is no longer any discharge from the eyes. However, this may not be feasible to everybody. Most daycare centers and schools require that students receive 24 hours of topical therapy before returning to schools. Adults may choose to go back to work. However, it is important to limit close contact with others. So there we have it, guys. If you all have any questions or topics you would like me to cover, kindly leave a comment down below. Thank you for subscribing, and I will see you next week.